start with introducing our first guest for this session, Maria Panagioti. She's a senior lecturer in health services research. Maria has expertise in evidence synthesis, quantitative research designs, and universal population-based suicide prevention approaches. Me and Maria and our team have recently been working closely on a study that Maria is going to talk about and Imran mentioned. So welcome, Maria.
Hello, thank you very much for this talk. Very lovely to be with you. And I'm sorry I had a technical problem, so I had to move in a different place. So I can.
Maria, I think there are some issues. You're breaking up.
I'm going actually to present some the design.
Maria, we can't. You're breaking up, Maria. And Samin, we are still getting these boxes on the screen.
Yes, ma'am. As soon as we sort out the problem with Maria, and then it will stop.
Okay.
I'm just waiting if she could change her location, maybe, because her voice is breaking. That's the only issue.
Maria, I think you're on mute. Oh, I'm sorry for this. I had a connection problem. I'm usually all day at Zoom and I don't have problems, but these things tend to happen when you need the connection most. Anyway, back running now. So I would like to present a feasibility study that we're planning at present in Pakistan to prevent self-harm in pupils at secondary schools. Next slide, please. Well, as you may have seen already, suicide is the second leading cause of death in young people. And most suicides actually occur in low and middle income countries. And in order to prevent self-harm, it is more fruitable. It's more productive if we actually focus on predictors of suicide. And self-harm is the most important predictor of suicide. The research has shown that it is likely that there have been more than 10 episodes of self-harm prior to one specific suicide or serious suicide attempt. Well, especially in Pakistan, self-harm and suicide rates have been increasing, although there are no official data on suicide rates in Pakistan because it is illegal and is considered a criminal act. Well, the main reasons for self-harm in Pakistan in young people are low levels of mental health literacy, stigma, few mental health professionals, and a large mental health treatment gap as well. Next slide, please. Well, especially for preventing suicide in young people, it is important to consider population-based approaches and universal approaches, such as trying to prevent self-harm in institutions where young people are based. And such institutions are, of course, secondary schools and even colleges, which allow to reach a large number of young people and prevent self-harm. However, school-based self-harm interventions are generally now only developing in high-income countries, and they're almost non-existent in low and middle-income countries. One of the largest trials in that area, can you go back, please? Yeah. One of the largest trials in that area that has been done in Europe is the SAIL trial. SAIL has been delivered to more than 11,000 pupils across 168 schools across 10 European countries. And it actually tested 3 separate interventions, targeting students, targeting also teachers and school staff, and also local mental health professionals. The SAIL trial has found out that reductions in self-harm at 12 months follow-up, which were especially significant and important for the YAM intervention, for one of the 3 interventions, especially the one targeting students. Next slide, please. Well, to describe the interventions in a bit more detail, I would say that the SAIL trial has focused on 3 different interventions because it aimed to reduce self-harm by increasing awareness about suicide risk and help seeking in students themselves. So they included one specific one universal intervention called YATH, Aware of Mental Health Program, which is a universal intervention targeting students, pupils, using role play sessions as well as interactive lectures about mental health and help seeking about suicide and depression. The second intervention was actually focusing, go back please. The second intervention was focused on gatekeeper training for school students and personnel. This package aimed to train teachers and school personnel on how to identify students who are at risk and, if possible, and refer them. And the third intervention was focused on training mental health professionals to actually to assess pupils, and for the ones who had reached the cutoff scores, refer them to appropriate mental health services. By doing this comprehensive program at different levels, the SAIL trial observed significant differences at 12 months follow-up. So, next slide, please. So the aim in this study was actually to culturally adapt, translate and culturally adapt these 3 preventative interventions, which are based on the main principles of SAIL, but also adapting them according to the main needs and the cultural background in Pakistan and testing its feasibility. So we're planning to develop an intervention to translate one intervention, universal intervention for students like YAM, or another similar program targeting pupils in secondary schools in Pakistan. We're also planning to translate and adapt and test the feasibility of a second program, which aims to improve awareness and training of teachers and staff members to identify students who are at risk. And finally, the third intervention, which aims to enable mental health professionals assess and refer pupils to local health services and social care services. As I described before, we're going to examine, once we translate the materials, we aim to examine the feasibility and acceptability of the 3 SEPAK interventions in 3 secondary schools in Pakistan for each of the packages. So 9 schools in total. So at the moment we have received ethical approvals, and we have decided about the interventions that we're going to translate, and we're in the process of obtaining the training materials and the intervention materials. So, and at the same time, we're doing a systematic review to understand which school-based interventions are effective for self-harm and which ones are best applicable to low and middle-income countries such as Pakistan. we're also planning to run focus groups with pupils 12 to 17 years old, their teachers and school staff members, as well as health professionals. And once we translate all the materials and we integrate evidence from the systematic review, we're going to ask stakeholders to review the intervention materials and ask their input and their experiences about the possible usefulness, as well as possible acceptability of these three interventions in Pakistan. After we have done these initial steps of translation and cultural adaptation, then we plan to examine the feasibility and acceptability of the three SEPAK interventions. We're going to use a non-randomized feasibility study in 3 secondary schools in Pakistan for each of the interventions. We have already established links with schools, with 3 schools across 3 different areas in Pakistan. And after that, we're going to follow with post-intervention interviews with the participants in these 3 interventions, which are young people, teachers and mental health professionals, as well as the deliverers of the intervention. We're planning to complete this study by the next June, and I'm really excited to see how it develops, and also about the outcomes of the study, because it can lead to one of the largest trials that have been done in low and middle income countries for preventing suicide, and has some practicality as well, because it doesn't require a lot of resources to be applied. And this is one of the reasons that we have a very detailed plan in terms of translating and culturally adapting the 3 SEPAK interventions. We don't want them to be very intensive, so they're not going because this might affect implementation. So we're trying to introduce simple and practical solutions that can be applied in the country. Yes. Oh, this is the main design, really. We don't have any findings yet, but I wanted to present the plan of it. So this is the overall, this is the flow chart of the study. It's almost like 3 feasibility studies in one. So initially we start, after we do the systematic review, which is almost done now, we do a focus group with students, mainly focused on their component, on the YAM intervention. Then we follow up with a feasibility study, and then with interviews to see how, almost like process evaluation. So we're following this scheme in parallel for the 3 different interventions. Thank you very much. I just wanted to say that this study has been funded. It's a partnership between University of Manchester and Pakistan Institute of Learning and Living, and is funded by an internal GCRF, Transdisciplinary Research Partner Development PAM Priming Grant. Thank you very much.
Maria, thank you, Samin. I'm unmuted now. Thank you very much. And thank you for leading and bringing this. This is such an important area of work for our youth, our teachers, our schools. I think moderators, in the interest of time, I would suggest that we move